We've managed to get 3 trucks in through Karam Shalom since the Rafah incursion began, and we have 60 WHO supply trucks waiting at Al Arish, unable to cross into Rafah due to the closure of the border. Fuel is particularly critical, as you know. The estimated requirement is 200,000 litres per day, and we have been able to get in approximately 70,000 litres per day at best. Some days none, so that's an approximation over what's been able to get in. So all the hospitals are really struggling and making decisions about what they can do. We have 14 hospitals that are officially still functioning, but what we call functioning, often they're not accepting inpatients, and they've had to limit what they can do, particularly in Rafah. Only Emirati Hospital remains barely functional, and there are 5 field hospitals, but all are overwhelmed and undersupplied. After the horrific incident, not a mishap, a horrific event, which WHO deplores the attack on displaced people who were sheltering in tents in Rafah. The numbers I have so far from the Ministry of Health reportedly killed 35 people, including women and children. The injured were treated by a WHO-supported trauma stabilization point, as well as in the 5 field hospitals that are being run by UK Med and IMC field hospitals, but it absolutely overwhelmed them. And you're quite right that many of the people would have suffered from terrible, terrible burns, and that requires intensive care. That requires electricity. That requires high-level medical services. Increasingly, we are struggling to even have the high-level skilled doctors and nurses because they've been displaced. They were all displaced by the incursion in Rafah, which meant they left wherever they were working